there. So thank you so much for taking the time this evening to dial into our IOP session. Tonight, our webinar is going to be discussing the Stop Smoking Medicine and the HSE Stop Smoking Services. But before we kick off, a few quick domestics. So as you'll have noticed, this webinar is being recorded. So therefore, we'd be delighted if you could keep your microphones on mute. Your videos, you can turn it on and off or as you wish, but do just be cognizant of your bandwidth. And if you're having any connectivity issues, maybe just turn your video off and that should improve that for you. Equally, if you're having any issues with your sound, just check your own speaker is not muted or turned down low on your own computer. And then if that's not successful, just maybe log off the call and log back into the call and see if that addresses any sound issues. We will be using the chat function tonight. So if you have any questions, feel free to pop them into the chat function. And then at the end of the talk, I will go to the chat and I will put any questions that you have then to our speaker, Martina. We may use some anonymized information from the webinar afterwards, just to let you know. And we will be having a quick, it's very short post-webinar survey, which is in the chat box now. You can click on it now or later at the end of the webinar tonight. So at this point, to introduce our speaker tonight is Martina Blake. And Martina is the national lead for the HSE Tobacco Free Ireland programme within the HSE. And she was joined by two of her colleagues who are going to support her this evening, and she will introduce them shortly. So at this point, I will hand over to Martina, and I will see you all at the end of Martina's webinar for the Q&A session. Thank you so much, Martina. Over to you.
Lovely. Thanks very much, Ruth. And I'm delighted to be invited to speak to you today. This evening. I know it's hard for a lot of people in the evening time after a full long day's work. So bear with me. We'll hopefully have it an interesting session for you and answer your questions, and that you'll be interested in what we're about to say. So as Ruth said, my name is Martina Blake. I work in the Tobacco Free Ireland programme in the HSE, and so we're responsible for coordinating tobacco control activity across the health service and stop smoking service delivery and campaigns. And I'll be telling you a little bit more about that as we go through this evening. And I'm joined by my colleague Elaine Buckley, who is the National Coordinator for Stop Smoking Services. So Elaine works to support the training of all of our stop smoking advisors and manages our quit line, among lots of other things. And Aisling Sheridan is also joining tonight. Aisling is our clinical guideline lead, and she manages our patient management system as well. So they're going to be answering your questions in the background, and I'm just going to share my screen and bring up the slideshow for tonight and go through what we're going to be talking about. So I suppose the underpinning policy and strategy that underpinned so the underpinning policy is the WHO international treaty. So there's a number of policies that underpin tobacco control work in Ireland. So Ireland as a government is signed up to the Framework Convention of Tobacco Control. That's an international treaty, and there's 168 countries signed up and legally bound to implement a number of actions around tobacco control. And the reason, I suppose, why there is such a treaty, it's because tobacco use is the leading cause of premature death and immortality in Ireland and across the world. 8 million people die from tobacco use every single year across the world. So still, one of the only products, I suppose, that, is available in every corner shop, and when used as intended, will kill half of all users. So that's why we have a treaty around it and kind of international efforts to try and tackle what we call tobacco epidemic. So we have the FCTC treaty that we're signed up to. We also have Tobacco Free Ireland strategy, which was published in 2013 and will run out this year. And that sets a goal for Ireland to become tobacco free, or what they consider tobacco free, by the end of this year. And when I go through the stats, you'll you'll realize that we're not quite there yet. But at least the vision is to kind of end the tobacco epidemic rather than just control it. So what our goal and our aim is to prevent young people from ever becoming addicted to tobacco. And that's the vision anyway, and to try and end this epidemic. So we also have a cross-government strategy, Healthy Ireland, which you might be familiar with. And within the HSE, we have our own programme plan, which kind of falls out of the government Tobacco-Free Ireland strategy, because that strategy is wide-ranging and has actions for wider than the health service. So for local authorities and actions for them for legislators as well. So we have our own 4-year plan for the actions that are relative to health service implementation. We also have a HR policy around tobacco-free health services, and I'll be talking to you a little bit about the National Stop Smoking Clinical Guidelines, which were published in 2022. So where are we today? We have made improvements and we have reduced smoking prevalence significantly over the last, 15, 20 years. But you'll see in the last, 9 years, we've reduced from 23 to 17%, but still not at that golden, goal of 5%. And 5% is essentially where we consider ourselves to be tobacco free, because there's an acceptance that there will be a small part of the population that will smoke, but 5% is kind of like considered tobacco free. And the challenge, I suppose, in reducing smoking prevalence is that we have reduced it generally among, population, but it remains stubbornly high among lower socioeconomic groups, and those who living in deprived communities, and their smoking rates can be double that of the general population. And the other complicating factor that has happened in the last 5 to 6 years is e-cigarettes and their use within society. It has grown and grown, particularly among young people. And e-cigarette usage is highest among younger people between 17 and 24 at 17%, higher among men than among women within that age group. But that has grown considerably. And just, I suppose, the other thing around e-cigarette use is that, we now see more dual use. So people using e-cigarettes and also smoking. So of the 20% of e-cigarette users, they're smoking daily as well, and 15% occasional smoking. And then 18% of e-cigarette users never smoke tobacco at all. So that's another, challenging factor in terms of, initiating nicotine addiction for a population that never would have started properly smoking. The annual impact of tobacco, why are we concerned about this? Why do we have a Tobacco Free Ireland programme? Why are we doing all this work? Because of the cost and annual impact of tobacco use in Ireland. And the underpinning data relating to this is a little dated and actually needs to be kind of updated. But in Ireland, we can see that there's 4,500 deaths annually a year. I suppose there is good intentionality among smokers in this country relative to other European countries. So about half of all smokers are trying to quit year on year. That fluctuates year on year, but it's around that 49, 50%. But huge impact in terms of hospitalizations. 44% of hospitalizations are in there purely because of smoking related disease. 300,000 bed days used. So that's the equivalent of, one of our large hospitals like St. James's or St. Vincent's, taken up entirely, every single bed taken up with somebody who's in there because of their tobacco use. And we all know the struggle that we have in terms of bed capacity, and that we don't have enough hospitals for our population. So this is something that's entirely preventable. And our challenge within Tobacco Free Ireland is to reorientate the health service and try and get further investment for prevention and tobacco control to try and stem that, chronic disease, powerhouse that's coming at us in the next 5 to 10 years. And tobacco use costs the health service 460 million, and that's potentially a significant underestimate. And then another unknown or lesser known fact is that 55% of all litter is tobacco-related litter. So a huge cost environmentally as well to our local authorities and to our environment, obviously. So I mentioned a little bit about what we do in the program. So our role is to kind of to denormalize smoking for the next generation. So we work with local authorities and sporting organizations to promote smoke-free playgrounds and parks and sporting facilities and try and denormalize smoking so that there's fewer and fewer places where smoking can happen in the public, and we trying to bring about clean air so that children are less likely to see smoking as a normal adult behavior and migrate towards that kind of behavior, because that's what children do. They migrate towards adult behavior. So if we can reduce smoking prevalence among adults, that's how we reduce smoking among young people. Um, Acknowledging tobacco use as a disease and treating, and that's why we have developed our clinical guidelines, and providing cessation support. So we've invested heavily in recent years in stop smoking services, increased the number of staff that we have, and we were successful in getting funding for stop smoking medication, and trying to, improve services, improve the way we deliver services, the way we record, and the way we get in referrals to our patient management system and various other projects. And then obviously working on providing a tobacco-free environment, both within our own health service and externally. That's a huge challenge and an ongoing challenge. And if you stand outside any hospital, you'll probably find loads of people breaching the policy. We depend on the public to support us, and it needs consistent effort by local management to implement smoke-free in hospitals and in primary care. So our clinical guideline, so we published a clinical guideline. Well, really it was NCEC that published it, but we would have done the underpinning work. So NCEC is the National Clinical Effectiveness Committee, and you're probably all familiar with the clinical guideline development. It's a committee within the Department of Health, and they request that we in Tobacco Free Ireland would do the underpinning evidence and submit the guideline for review. So, there was a number of pieces of evidence reviewed in order to come up with what was best practice around recommendations for stop smoking care. So, HRB did a couple of studies, and HICWA commissioned a health technology assessment looking at the evidence that was already available around what works. And then there's the judgment and decision. So looking at the evidence and what works and making a decision about what you would recommend based on that evidence. And then, getting that quality assured by international peer review, and then coming up with the guideline in January of 2022 is when it was launched. So within the guideline, we looked at a number of things that might work in terms of stop smoking care, and e-cigarettes was looked at by our the department commissioned HRB to look at e-cigarettes. And within that review, they looked at a number of things. So they looked at whether or not e-cigarettes were effective as a smoking cessation aid, and whether or not e-cigarettes had other implications for young people, whether it was a gateway to smoking, regular tobacco use. In terms of whether or not e-cigarettes are effective in terms of smoking cessation, what they found is that they were no more effective than licensed medications that are available. And in terms of the gateway effect, they found that young people who vape were 3 to 5 times more likely to start smoking regular tobacco in later life. So based on those two pieces of evidence, the decision was that we would not make a recommendation for e-cigarettes as a smoking cessation aid because of the potential harm of, further, complicating the issue around e-cigarettes. And when there was a licensed, there are several licensed evidence-based stop smoking medications that are readily available, and that we should focus on making recommendations and improving uptake of those medicines. So that was the decision that was made in terms of e-cigarettes. The other things that work and are recommended within the clinical guidelines are the basic things that you already know probably in terms of brief intervention. So asking about smoking status at every opportunity, advising that smoking cessation is the best thing for health, and arranging effective care. And what we mean by arranging is referring into an intensive behavioural support service and arranging stop smoking medication for your clients or for your patients that smoke. So those three simple steps are, clinically recommended. So behavioural support, what does that look like, and what's the recommendation around that? A number of things work. So individual or group counselling, and we provide both of those options within the HSE stop smoking services. Telephone support, so we have a national quit line. Text messaging support also has evidence-based and works, and we provide that through our quit plan, and internet-based support, and we have an email and web-based support as well through the internet. Obviously, stop smoking medicines, in terms of those, first line recommendation is varenicline plus or minus nicotine replacement therapy. If varenicline is unsuitable or not available, as it has been up until very recently, combination NRT is first line recommendation. And then second line recommendation is NRT monotherapy or bupropion. So those are the recommendations within the clinical guideline from 2022. So how does the stop smoking service work? So we have a number of different, referral options for people to get into the service. So you can self-refer, you can pick up the phone, ring 1-800-201-203, the quit line. And for January, we're open really long hours and 7 days a week. And we have a campaign. You might have seen our TV ad on some of the channels, TV and radio. So you can self-refer on the Quit website. You can go on, you can find information to access the service, and you can look up your local service and search for your county and find any one of our 300 clinics on there. You can be referred by your GP electronically. So we have integrated our IT system, the patient management system, which we call Quit Manager, with HealthLink. So we can populate electronically a referral from GPs. They just click quit and it comes in centrally and is managed then by our quitline staff. And if you happen to live in Cork, for example, and you want to see a local stop smoking advisor in Cork, your referral will be populated into their work list, and then you'll be called and you can engage in an appointment. We also have local referral pathways. So some of our local services, advertise QR codes and their own local phone numbers and email addresses in order to refer. And then for yourselves, as health professionals, you can refer through a paper referral, through email, and electronically as well. In some cases, HealthLink is available for some health professionals. This is just a map of some of our services. We don't have them all there, but you can see a lot of the counties. We also have We Can Quit Stop Smoking groups. So we have 50 of those running every single year. Those are peer-led group stop smoking support services. They run for about an hour and a half each night for about 7 weeks. And they're run by stop smoking advisors who are lay people and who are trained as stop smoking advisors and work in their own community. They're usually located in disadvantaged communities, and they work really, really well in terms of kind of engaging and with the local community, and engaging the group support can really help, because it's everyone is kind of going through the same journey at the same time. They can support each other through the process. So we have an evidence-based standard treatment program for smoking cessation. We deliver the training to all of our staff across the country. There's online training and then face-to-face training. And our staff are trained in kind of the knowledge, behavioral support methods to try and support somebody through health behavior change. And then they also attend skills to practice face-to-face training and then subsequent training on the use of our IT system and followed by mentoring in the field where they're supervised and supported to listen in and be mentored by a more experienced advisor in terms of stop smoking care. So what will happen when someone gets one-to-one behavioural support? Usually the support starts 1 to 4 weeks before a quit date. Now, in some cases, if somebody accesses an acute service and they come in acutely unwell and they're what we call a spontaneous quitter, they might have had an acute episode. They might start straight away, and then the counselling and the psychological support starts when they're well enough to receive it. But in most cases, we encourage clients to, prepare for their quit date and get ready in their head and psychologically for their quit date, get prepared, plan it, make sure they have their medication for their quit date, make sure they're aware of their triggers, they've, confirmed their own motivation, they've kind of really considered the process and how they're going to achieve their successful quit. And then we offer a minimum of 9 appointments over a 12-month period. So we talk to them 1 or 2 times before their quit date, on their quit date, again at week 1, post their quit, week 2, week 3, week 4, 3 months, 12 months, and 24 months. So it's not a one-off service, and then the client can engage with us outside of those times as well if they're struggling or they're finding it difficult, or, they can re-engage with us at any time and get further support. And 18 months ago, we were really lucky to introduce free stop smoking medication, free nicotine replacement therapy for anybody, regardless of whether or not a patient had a medical card. So we were successful in getting funding from the department for that. Some of the information on this I've gone through. Just, I suppose, to talk a little bit about the quit plan. So when you log into the website, you can log into a quit plan. You can set details in there, information about your motivation for quitting, your reasons for quitting, what you might, why you smoke, why you want to quit, how much you're spending. So there's a cost calculator in there which will track your savings and feed that information back to you. So the quit plan will send you emails at the set times that you agree and you set within the program to try and motivate you and keep you on track. And it will say, if you opt for the option for text messages, you can get text messages as well, or you can get both. And we encourage all of our clients to access every kind of support. So take it all, and hopefully you will have a successful quit. And obviously come in to talk to an advisor and get that personalized support as well. We have a Facebook page as well that people can access, and a lot of people find that very helpful because they can talk to other people who have quit as well, and get that motivation and get that support. And we moderate that Facebook page on the Quit Line. This is just a breakdown of the time that it takes to kind of provide that behavioral support. So the 2 pre-quit contacts take about 45 minutes each. And then the quit date contact is about a half an hour, week 1 follow-up about half an hour. And some of the other weeks then can be a little bit less, depending on the client. Now, some clients need more support, and if there's other complicated factors, if they have a mental health difficulty, or, maybe they're pregnant and struggling, all of this is moderated, but it's just a general kind of guide to the kind of behavioral support that we provide. We have QA standards as well. So Elaine, who's on the call, my colleague, who's the national coordinator, developed QA standards a couple of years ago, which our staff follow, and we were lucky enough to get those endorsed by the World Health Organization. So we would be considered, world leaders in smoking cessation, and we've often asked to, speak to other developing countries and countries who are not as advanced in terms of their stop smoking care as we are here in Ireland. So that's really nice to be asked to do that. So sometimes people think that we, as or that our staff as stop smoking advisors, we just tell people to quit, and tell them smoking is bad for them and they should quit, and that there's a judgment within the behavioural support. And it's really important that you're aware, that you're able to communicate to anyone that maybe comes in and looks for a service, that it's a non-judgmental service. Sometimes we have people who slip up along the way and relapse or have a slip up, and we try and encourage them to get back on track, and re-engage in their quit attempt, and there's no judgment. A lot of our staff have been smokers themselves, and they know the challenge. Nicotine addiction nicotine is really highly addictive, and there's the psychological, the emotional, and obviously the physical addiction. And some of the evidence would even suggest that nicotine in and of itself is even more addictive than heroin. Hence we really need to get focused in terms of the way we manage and treat that addiction. So, heretofore we probably haven't invested and stressed enough that we need to work on all of those three things, the behavioral, the emotional, and the physical addiction, and tackle all of that. So we know that medicines roughly double a smoker's chances of quitting, and behavioral support also doubles the chance of quitting. And so we use those kind of exercise, reflective listening, motivational interviewing, and non-judgmental support through our services, and obviously the provision of medication. So over the last couple of years, we've made improvements to the way we deliver our service. So we have had significant investment from the Irish government through Sláintecare. So we grew the staff through both Sláintecare and enhanced community care investment. And we have now what we call WTEs, or whole-time equivalents, about 73 staff working across country in terms of smoking care, whose job it is to provide intensive support. And we have had investment. We now have 1.8 million, and we're hoping to have 2.3 this year, when the next lot of budget gets loaded for stop smoking medicines. So that's really welcome. Clinical guidelines obviously guide us in terms of how we treat tobacco addiction as a disease. We have a national patient management system rolled out pretty much to all of our services, electronic referrals, and we're still working on some of that, improving electronic referral across lots of different care areas. And the service is delivered by a whole range of staff, so health promotion officers, clinical nurse specialists, midwifery specialists, and lay people that work in the community and are trained as stop smoking advisors. So it's a whole gambit. This is just an image of a mouse mat that we created a couple of years ago, after we launched the clinical guidelines, which reiterate the kind of key 3 steps: ask, advise, and act. And just have a quick guide in terms of the medications and the dose, and how to administer them. And just for yourself, in terms of direct referral, since COVID, all community pharmacists particularly, and hospital pharmacists would also have, HSE emails. You can email a referral in to quit@healthmail.ie, and all we need is the client's name, their date of birth, and their phone number. So if a client is willing and agrees, you can send in that basic information to us, and then we'll populate their record within our referral, and begin to proactively engage them. So, just to kind of point out, I suppose, the difference between signposting someone into a service and making a referral for them. And depending on your capacity and availability to do that, what we'd love you to do is make a referral rather than just signposting. Because a lot of the time when you signpost, or you give somebody a leaflet, or you say, look, you should consider, the person might go away and go, yeah, I'll do that, and the leaflet sits in the bottom of the bag or whatever. But if you've made the referral on their behalf, If you've engaged with them, then we're proactively engaging with that person within 3 days, and sometimes that can translate into a successful quit. That can be the step. Somebody has proactively called them. So that's the email address there, quit@healthmail.ie. And some of the local services have local arrangements as well in terms of referral. So you might be familiar with some local arrangements of how you refer. Just wanted to draw your attention to a new resource that we published last year. So we produced this new Stop Smoking Medicines and How to Use Them e-learning course, and it's sitting on HSE land. And this will build your knowledge and skills and confidence around stop smoking medicines, and uh, give you a summary of some of the key clinical guidelines, and discusses all the stop smoking medicines, and their actions and interactions. And it's designed to be relatively short, 45 minutes. And if you search for stop smoking on HSE land, you'll find access to that training. It's just an image of some of the stop smoking medications that we produced for some of our resources. So we recommend combination therapy. So it's slow acting products like the patch with some of the faster acting products. And that's just an example of some of them. Some of the challenge we've been informed by one of the companies that the inhalator is going to be unavailable to order soon, and there's some stock issues with and some challenges with a component of the inhalator, and that they can't produce it any longer. Although I think it's still available, we haven't stopped recommending it. I think it's still available, but we've been told that it may become a difficulty in due course, which is unfortunate because it's a really good product, and a lot of clients love that hand to mouth action, and kind of really really value that product. So hopefully they will kind of resolve those issues. So we, as you know, have introduced free NRT. We put in a funding bid into the department to initiate free NRT in 2022, and we got an initial budget of 726,000. They increased that budget by 1.1 million to 1.8, and this year we're expecting another 0.5 million to 2.3. We would love to have this scheme through PCRS, and to have to be able to administer free medication through every pharmacy, community pharmacy in the country, because that's where patients go for all of their other medication, and they can get access to community pharmacy support, and further motivation, and kind of confirming their quit attempt, and support, and that's really really helpful. But unfortunately, there's no scheme through PCRS or DPS to provide free NRT at point of contact yet, although we're hoping that that might change into the future. So the way we administer free medication is through local arrangements in each CHO region. So they have arrangements with some community pharmacies to kind of administer the scheme. We have a national procurement process underway to secure a national provider or conglomerate of pharmacies to administer the scheme, because current arrangements that we have are really really complex and difficult administratively, and we're paying different rates as well for medication across the country, and we need kind of economies of scale. But this is really an interim measure. Our vision and our hope is that we would have further engagement with PCRS, and we presented a paper to the pharmacy task force there just before Christmas to try and negotiate a process where all pharmacists can kind of participate in this scheme. So that's our plan into the future for free medication. So just to talk a little bit about varenicline, one of the first line meds that's recommended within the clinical guideline, up until very recently hasn't been available, was taken off the market. They're year and a half ago, and was just relaunched in December, just gone. Just some notes in terms of the medication, and obviously you need to consult your SPC for full details, but some adjustments to the dose might be necessary for people with various conditions or on various other medications, there warfarin and insulin and some more, but the SPC has full details on all of that. The challenge with varenicline is that it's not yet available on the GMS or the DPS scheme. I understand that the company has made an application to the CPU for that, and that's still under consideration. We have a challenge in terms of kind of administering it through our free budget. We are, our not free budget, but our budget for administering free medication. So we have a budget, and ideally we'd love all medicines to be available through that budget. But the challenge for us, I suppose, is that because this requires a prescription, complexity of trying to get a prescription paid for free at the point of care for a client is challenging for us, and also because it's not yet approved by the corporate pharmacy unit. We have to wait till that approval happens before we kind of consider mobilizing anything more about varenicline. But it's available for private patients right now, and they can access this first line med if their GP prescribes. Cytosine, another drug, are just introduced into the Irish market, and first cousin of varenicline, works on the same receptors in the brain and kind of blocks those nicotine receptors and reduces urges and withdrawal symptoms. More information available on the HPRA website, and consult the SPC there. It's a kind of a sliding scale in terms of the dosing for this medication over 25 days, and a little bit more complex for the client, because there's regular tablets at our different 6 tablets for the first to the third day every 2 hours, and then 5 tablets every 2.5 hours. So a little bit more complex to kind of to administer, but another drug that has been approved by the GMS and DPS scheme for public reimbursement. I would say that a lot of GPs are probably not familiar or aware of it, although I can see some prescriptions for it coming through, or we're hearing of clients who are coming through our service that are being prescribed it, but hasn't really taken off just yet. Our challenge with this medication at the moment is that there's no recommendation within the existing clinical guideline because it wasn't available or considered, because it wasn't available in Ireland at the time of the review. We'll have to, when the clinical guideline comes up for review, we'll be looking at that, but has been approved and funded under GMS and DPS for public patients. So that's positive. So this is just a snapshot of some of the resources. So I just wanted to point you and tell you about helppromotion.ie. So on that website, you can log in and register as a health professional and order a whole range of resources. So some of the other things that we do, and I have some pictures of some of the resources there, but just back to this slide, other things that are happening and that we're working on within the program. So obviously we support the Care Healthy Communities and the We Can Quit program, which I mentioned earlier on. That's the peer-led group stop smoking support, and we're kind of scaling that across the country. We're also involved in a new stop smoking program where we're going to pilot financial incentives for stop smoking care. So this is where we're going to bring people into stop smoking services and monitor people and provide incentives in the form of a voucher for successful quit. So we'll be assessing through carbon monoxide monitoring their quit, and providing incentives, and that's a HRB funded study. Financial incentives have been implemented in the UK and other jurisdictions, and there's a Cochrane review indicating that they're highly successful in motivating quitting, particularly in disadvantaged population groups and low income people in low income groups. So we're really excited to be starting that pilot, and we hope that we will be recruiting patients into the financial incentive stop smoking program come early March. We've also invested in stop smoking care in maternity. Lots done, but lots more to do in that space. We don't have a service in every maternity unit, but in some of the larger ones, we do have on-site stop smoking care and smoking pregnancy. We have a number of resources around that. As I said, vaping and e-cigarettes have complicated the agenda and taken a small team's focus from tobacco control into this space. So we've produced a lot of resources for schools and parents around vaping and e-cigarettes as well. So you can order all of these resources. So the pregnancy poster, these are some new posters that we produced. Those ones aren't available to print now. The I'm ready to quit or I'm not ready to quit smoking, but just showing you some of the designs. But all the other ones are in hard copy and you can get from healthpromotion.ie. If you register as a health professional, we have a new quit booklet guide to help you quit smoking, and we have another one for those with mental health difficulties. So it has a special focus on quitting if you have a mental health difficulty. We have that card there. Our support will double your chances of quitting and dealing with cravings on the back. It has our contact points, and then that poster there, stop smoking and take back control. Some other resources, stop smoking medications at a glance, that can be ordered through healthpromotion.ie. We have some mouse mats in stock that Ask, Advise, Act. You can order that. And we have stop smoking during cancer treatment as well. And then this is the information and the links to some of our resources. So the clinical guideline, we produce a state of tobacco control report in 2022. Every 4 years we produce one. And some stats in terms of our Healthy Ireland survey, stop smoking medicines, how to use them, the link to that, making every contact count, our website, and then where you can order all of those resources. So I'll stop talking there. And we can get a bit more interactive in terms of what people have questions or if they want to hear anything.
Thanks a million, Martina. That was super. I'm full of information after that. So
Brilliant.
if anyone has a question, feel free to pop it in the chat, or if you're comfortable, turn on your mic or your camera, whatever suits you best. And you can ask Martina or Ashleen or Elaine. I kind of have a quick question that I was just wondering. How, if I have a patient come in, how can I get them access to that free NRT?
So in order to access the free NRT, they need to, set a quit date with the stop smoking service and be part of the program. So like some people, when they hear the ad that you can get free NRTs, we've lots of social ads and ads on Instagram and all the different platforms, and they think that when they sign up to a quit plan that somebody's magically going to post them out loads of medication and they can just quit. But it's through a supported quit attempt. So they need to contact a stop smoking advisor. So if you have anybody that's coming in and looking for free NRT, advise them to come into the stop smoking service, set a quit date with the stop smoking advisor, and then we will, when they're ready to quit, we'll arrange for the stop smoking medication to be either posted out to them if they're accessing it on the quit line, it's through a postal service, or through their pharmacy, participating pharmacy. They go in and get it that way. So that's the way that they get the medication.
And then what's your preferred way for us to kind of refer a patient onto the service?
Well, through the email,
Okay.
preferably, the health mail email. We're working on trying to get, there's other options potentially that pharmacists could get set up as referrers on Quit Manager, but it's a little bit more complex in terms of, accessing as a third party through Citrix and whatever. But once it's done once, you're kind of through. But we're just kind of working through the logistics of that and engaging with our IT colleagues. But right now, you can email the name, the date of birth, and that information, and get the referral into us, and we'll start engaging with the client from that point.
Okay. And then just if I'm chatting with the patient, can you quick two or three quick bullet points of what does that look like for them. So I'm going to send them on the referral. They're going to get contacted. What does the support they get look like then for the next number of weeks and months?
So they'll get either a face-to-face appointment if they want to, and if they're available, they can come in and speak to an advisor, and they'll get that 40 or 50-minute appointment, their first one where they're going to get a full consultation. They'll be asked about their smoking habit, their nicotine dependence. They'll get a carbon monoxide monitor, and asked about their motivation to quit, and they'll be encouraged to set a quit date. And then they'll get an appointment on their quit date, week 1, week 2. Several appointments will be arranged throughout their full 12-month period. Some of them can be face to face. Some of them can be online, like this, in a kind of a chat kind of format, or they can be over the phone. But we encourage at least a number of them to be face to face for where the face to face where they're available to come in. And so that's really what the service looks like in terms of
Okay.
behavioral support. And then we arrange the medication for them as well. Um, and patients can access the online and the soft support, as I call it, as well. You know what I mean? All of that other support that will just kind of go out to them. But talking to an individual with everyone's quitting journey is unique to them. So their own kind of challenge, and that's where the advisor will kind of engage with you at a personal level and kind of really try and help you to overcome. And if they slip up along the way, we encourage them to come back to us and not to be afraid to kind of re-engage, because it's a chronic relapsing condition. Sometimes it takes a number of attempts to quit successfully. So not to give up on quitting, to keep trying is what we try and encourage.
Okay, thank you so much. Elaine, I see you answering some questions in the chat box there. Do you want to just talk us through what you're talking about there, just to see if you're trying to read and listen simultaneously?
Sure, yeah. There was just some questions about bupropion and was it still recommended as a stop smoking treatment? It is, but it's not first line. So I've posted the link for the clinical guidelines there. So varenicline is the recommended first line treatment. If it's unsuitable or unavailable, as it has been, our second first line treatment is combination NRT. Then you move down to monotherapy. Then there was a question about the matter. Is there any other hospital in Ireland who uses any other medication apart from NRT? So the stop smoking advisors who aren't in every hospital in Ireland, actually, I think you covered that, Martina, didn't you? We unfortunately don't have staff
Yeah.
in each and every hospital, but the guys will recommend again either varenicline or NRT. They'll follow the clinical guidelines.
Okay. And
I
there's
don't know if that
another,
answers the question.
hopefully they can pop some more questions in if it doesn't. Someone just asked there, it is very difficult to give up smoking. So is there any limit on a patient going back into the service or being referred back a number of times?
No, we take clients on a cycle all the time back into the service. Now we're going to have limits on the incentivized quit program. When that comes on board, you will be able to access the incentivized quit program twice, but you will still be able to access stop smoking program, but you just won't get the incentive a third or fourth or fifth time, because we don't want potential gaming, I suppose, of the incentive and people coming through and relapsing, to try and gain an incentive. But that's the plan for the incentivized quit program. But they will absolutely be able to access the regular service, and we take people back into the service all of the time, because we understand sometimes it takes a number of attempts. Yeah.
Perfect. And Orla was asking about a client of hers there who is a newly diagnosed throat cancer patient, but also is a smoker and a drinker. So they have been advised to register with you. So she was just asking how long it would take. And I see Ashleen, I think, has said within 3 to 5. This is outside your remit, but she was wondering, is there any equal service for alcohol that she can refer her client onto, or would she have any insight into that?
I've popped a link
Yeah.
into the chat.
Yeah.
Thank
Sorry,
you.
Martina, I've
Yeah,
just
no,
popped a
go
link
for it.
into the chat. There are local drug and alcohol clinics run by the HSE. I know there's one actually in the ground floor of the building that I work in, each Wednesday, I believe, but I'm in Tipperary. But I think through that link, if it's not the right link, I've just been looking for it there, I can get it over to yourselves and it might list the HSE alcohol services.
Yeah. There is an alcohol support line, and there's a website, askaboutalcohol.ie as well. So we'll send some of those links so that you can pop them up onto the IIOP website afterwards. And there's a colleague of mine that works on the alcohol program itself, and they're doing similar work that we do in terms of seeking investment from the department to address alcohol harms and alcohol addiction and improve services for people. There's, online tools as well, scores for people that can, or like tools that you can set, put in and get a score back in terms of your alcohol dependence, or, sometimes it's not a dependence, it's just like harmful alcohol use, which, can happen as well. So yeah, we can provide those supports for people, and provide the links for where to access. Unfortunately, they're not as prolific as stop smoking services. They haven't been as fortunate as us in terms of getting the funding to scale that. Alcohol and investment in alcohol is less politically, you know what I mean? It's just difficult politically as well, so just haven't been as fortunate as us in terms of getting investment.
Yeah, you've done really well. Well done. You've obviously put a good program together and demonstrated that's worth investing in. So that's excellent. Thank you so much. I don't see any more questions coming through, but feel free to pop any in if you have any. Um, Martina, Elaine, thank you so much, and Ashleen, wherever you are, for supporting us tonight and giving us
Yeah.
all that information, because it is really useful, and it's great to know that there is, you know, support, really quality support out there, and then free access to the medicines that patients will need. It would be great to see the PCRS. So if you keep pursuing that
It
path, we'd
would,
all be terribly
absolutely.
grateful for your
Yeah,
efforts
we
in that
really need
space.
that. Yeah,
Because it is that
yeah.
reality of community pharmacy are so accessible to members of the public, and we've opened such long hours, that it would be a wonderful way of supporting your program. And I'm sure something most pharmacists would be more than welcome to have in their community pharmacy as well. So thank you both. Thank you to everyone for dialing in. I will remind you that we have our survey. If you wouldn't mind just taking a quick moment now, we'll put it in the chat function, so that you can do it quickly and give us a little bit of feedback so that we can ensure that these programs are meeting your needs as pharmacists. If you can take another 2 minutes at the end, just do a CPD cycle. Even if you get it started tonight, pop in some key points, so that you have that ready to go, so that you're starting your reflective cycle for your IIP cycles. Looks like they might be going annually, so we'll all be desperately trying to do those all the time. So once again, thank you so much for dialing in. We will be back here again on Wednesday, the 12th of February at 8 o'clock. And that session is going to be on breastfeeding. And it's going to be presented by Deirdre Darcy and our own Dr. Aoife Fleming from the School of Pharmacy here in UCC. So that will go out on the usual social medias. And once you get the link, you might sign up for that session. So thank you all so much. Thank you to the ladies for dialing in and giving us all that information on the Stop Smoking campaign. And we will endeavour as pharmacists to support you through your programme as much as we can in our settings as well. So thanks to everyone for dialing in. Have a lovely evening.
Thank you very much.
Good
Take
night.
care. Good night.